All right, so that is how we begin another very, very beautiful Saturday night right here on GHOne TV. Welcome to Duvet. My name is Natalia, and just like we do every Saturday night, tonight we are talking about vaginal trauma, right? If your vagina goes through some trauma, how do you give it healing again? How do you get it back to be in a position to enjoy sex and do all the other things that a vagina has to do? That is where we are at tonight. Remember, we're streaming live on all our social media platforms. We are on X, we are on YouTube, we are on IG, and we are on Facebook, GH1 Television. Again, my name is Natalia. Connect with me on social media at Yes, I Am Natalia. Tonight, my guest, I have Dr. Azusong, who is a psychiatrist and clinical psychologist. And you're welcome, Dr. Azu.
Thank you.
I've missed you. I've missed you. I think that this year has been really good for you and I.
Ah, really?
Yeah, I've seen you a lot of times this year.
Outside of the studio.
Outside of the studio. Yes. You're welcome.
Thank you very much.
And then I have Chelsea Owusu Ansa, who is a celebrity massage therapist. Chelsea, you're welcome.
Thank you very much.
And then I have Princessa Agri, who is a certified sex therapist. Princessa, you're welcome.
Thank you.
How have you been?
I've been good.
Okay. Now, let's get into it. Sex after vaginal trauma. Princessa, let me start with you. What comes to mind readily when we talk about sex after vaginal trauma, right? If your vagina has been through some trauma, how do you come back to enjoy sex?
Okay, let's start with what's trauma, because some people might not know that they're going through vaginal trauma if they don't know what trauma is. Vaginal trauma is when your vagina goes through pain or goes through forceful penetration or something sharp was used inside, was inserted or penetrated inside it. And also, every woman who has done vaginal birth goes through vaginal trauma. And if you've fallen, like if you're a lady, maybe you rode a lot of bicycles and you did a lot of sports, your vagina might have gone through vaginal trauma. And again, let me say, if you climbed a lot of trees and you fell on the branch, which is called a straddle injury, your vagina has gone through trauma. Right. And for the people who have done vaginal birth and then you had a tear and episiotomy, that's another kind of trauma. Or maybe you were walking or you hit your lower abdomen, your pelvis. You could also go through vaginal trauma. So that is what vaginal trauma really entails. And sometimes you might not know that your vagina is going through trauma. You might just have a little bit of bleeding and then it goes up for a while. And then sometimes it could show in lacerations. Sometimes it could show like, you feel this pain inside. I cannot explain the pain. It's not outside, but it's inside of me when I'm trying. You see people complain of painful sex.
Right.
So most times it's not infection. You're having trauma. Your vagina is going through trauma. That's why you're having painful sex.
Interesting. I like this explanation you just gave. I think that I may be going through vaginal trauma at the moment because 2 days ago I fell down the stairs, but I fell in such a way that my bum sat on the I slipped and
yes, you're going through trauma. Yes.
I am, right?
Yes.
Okay, so we'll talk about how you can help me heal in a little bit. But Chelsea, tell me, what comes to mind when you hear vaginal trauma?
A whole lot, actually. It's a whole lot. And, young girls these days goes through this vaginal trauma. And I don't even know how to explain this. I think she's said much of what I want to say.
Okay.
Vaginal trauma, like we said, is a painful penetration, like whereby a man forcefully have his way in a woman, hence causing bruises around the vagina area. And sometimes too, it can lead to an infection because the area has been exposed to some cuts, you understand me? So vaginal trauma is something really, really bad. for a
Right.
woman to experience, especially when you are coming up. You see some young people, they are being raped, unknowingly, child can be molested,
Yeah.
all those stuff, a whole lot. So this vaginal trauma thing is something that we need to really, really, really talk about very, very well. And I really like the topic tonight, actually. So vaginal trauma is something that can even affect a young girl psychologically. It
Right.
can even make the girl have this fear in her to even approach a man. It can keep a mark in the person's brain, of which
Right.
sometimes when you want to come close to a man, when you remember your past, you'll be like, you don't want to go close to a man. So it's a very, very, very strong
Right,
something,
right.
yeah.
Okay, I like that you touched on rape, right?
Yes, please.
Dr. Azu, let me come to you. For women who have gone through that, how would you advise that they, go through the process to feeling better again, not just psychologically, but also taking care of their vaginal area?
Yeah. So before I come to that, I would just want to add on to the numerous things they have said
Right.
with regards to vaginal trauma. In addition to what they have said, vaginal trauma also occurs in normal sexual intercourse.
Right,
You understand?
right.
Where if you have good, proper sex, you know that the sex that you have had is good and proper sex. The following morning, when you wake up and you are weeing, you feel some burning sensations.
Right.
There are minor tears in your vaginal wall.
Okay.
And if you look at the layers of the vagina, you have the mucosal lining before you get to the muscle, and then you go to the fatty tissue and then all these other things.
Right.
And there are various degrees depending on where the tear has reached.
Right.
But you can have it in normal sex,
Okay.
and then you have the vaginal tears occurring.
Okay.
And for someone who has gone through rape, of course, it's an unpleasant,
Yeah.
Experience.
an unpleasant experience. And like Chelsea said, it can leave a mark and a scar on the person's
Lives.
not
yeah.
just the trauma that the person has gone through physically. Some people go through rape without even getting vaginal
Yes.
physical trauma.
Yes, yes.
That's
Right.
right.
You understand? In some instances, they may get a physical trauma, but the physical trauma is the least of the problems that they are going
Right.
through. It's what is in the
It's
head.
the mental
You
trauma.
understand?
Yes.
And especially if it is the first time. Our goal now is
When you say
to-
the first time,
if it is the first time that
You're
this person
experiencing
has not had
such
sex
something.
before.
Yeah.
right,
Like a
okay.
You
virgin.
understand? Yes.
Yeah.
This person hasn't had sex before.
So this
And
is their
it's
introduction.
First, your
Yeah.
first introduction to the sweetest thing that I like, the sweetest thing in the world.
That
The
you
word
know.
right
That-
now.
no,
It's
that I
so
know.
Yeah.
You know, everybody. You
Yeah.
know, anyone who has had good sex would know that there's nothing sweeter than sex.
Yeah.
Thank
Of
you.
course.
And yeah,
It's
thank
a
you.
natural
You're welcome.
sweetness
You're welcome. Natural
spices.
sweetness,
Yes.
you
It's
know?
a natural sweetness spices. Yeah.
Thank you very
You can
much.
go
It's
on.
the,
Thank
the,
you
the
very much.
sweetness cannot be explained.
It cannot be explained.
Yes.
And so imagine a poor lady who, instead of experiencing this sweetness, the person experiences it in a bitter way
right,
and further causing trauma to them. So all we need to do is we need to what we call psychodynamic therapy.
Right.
If it has happened in the past and the person has kept that scar, what we need to do is to help that person to get to acceptance that this incident had already happened. Whatever we do, it cannot be taken away.
Yeah.
But what can we do to ensure that the person goes through a healing process and remind the person that you can enjoy sex again?
right.
You understand? And that this is not the last thing. So
Right.
basically, that is what we will try to do with the
Right.
person. But it is also, I must say that it's individual dependent, depending on the circumstances surrounding
Around it.
Who is it that did it, and all of these other things are very, very important in
Okay.
giving the person holistic psychotherapy.
Okay. So I'm sure that, I mean, they go through steps
Yes,
too.
Yes.
Because
exactly.
I'm thinking that obviously then it makes you, should you start getting in a relationship again, you feel a certain type of way with your man or whoever you're with, you know, so
Exactly.
that even when they are trying to touch you, then it feels really,
Exactly.
Yes, it feels
exactly.
cringy.
Yeah,
Yeah,
that's
it's
why
like,
before you can do this, you have to change environment. Sometimes environment will also affect our psychological thinking. Do you understand? For example, if the incident happened within the area, I think it is being advised for the person at least change location to a place that you don't even know very well, so that you can be able to forget your past and move on. Yeah.
Right.
Yeah.
Yeah.
So that is, I mean, is dependent. In some
Yeah.
people, in some instances,
They may not. They
may
can't
not be able to change
able
the
to change
location.
their
Yeah.
location.
Locations.
Yes, but they still need to
They still
heal.
need to. They still need to heal. So, but changing location, of course, obviously,
It
is good.
helps.
It
If you
helps.
It
can.
helps if you
Yes.
can.
If you can.
You
Yes.
understand.
Okay.
But
Yeah.
if the man is there, and you always see the man, and all of these things can, you know.
So what
I think,
are we going to
we
say?
we can give, like, this is where a therapy has to come in here.
Yeah.
You see, for such person, I think that now this yoni massage therapist is needed in such a way that if the man truly loves this girl and the girl feel the kind of shock all the time, I think the man can be able to help massage the area, you know, sit in the hot water. There is a whole lot of way to make sure that that place doesn't feel bad whenever he or she is going in there, something like that.
Yeah.
Okay.
You know, yeah.
Interesting. Princessa, tell me something. Typically, how long does it take to heal? You know, because Dr. Azu said that even with regular sex, like maybe with your husband or your partner, your vagina can go
Yes.
through the
Yeah.
trauma.
Yeah.
You know, also because sometimes, you know, you have whoever, your man or, you know, some men who just won't take their time to prep you. You know, sometimes you're not like all the way, your juices are not flowing all the way, and they're in a hurry to, like, you know, I would just, you know what I mean?
No, I like,
Yeah.
oh, no,
Yeah, go
I know what you mean. I know what you mean.
They don't allow
don't
your
allow the
juices to
juices,
properly
yes.
flow, and
Yeah.
they're in a hurry to just go in. And obviously that will cause trauma to the vagina as well.
course.
How long does it take for the vagina to heal?
It is dependent on the individual, especially in therapy. Like I don't like use the textbook method on all my patients.
Okay.
No, because you could have a patient who will heal in 3 days
Yeah.
because of their mindset. Well, it will take another person 3 months to heal just because of their mindset. So it's individual dependent when it comes to this. But another thing, when you said that we could, like doctor said, you could have trauma normally when you're having normal sex, and like you said, do we wait for the juices to flow? You see, the woman's vagina, like my husband said I should change my profession from sex therapist to vaginal
Vagina what?
expert. You know, because I'm so particular about the vagina because it's your yoni, it's your temple, it's your
Yeah.
portal.
Yeah.
A lot of things happen there, and we store, as women, we store a lot of trauma down there. In your hip area, your pelvis region, a lot of your trauma is rested there. So what do you do? For the men, I would please beg you, don't be in a hurry. See, the woman is wired some way, be that I will
Oh, did you
always
just say that? Ghanaians have influenced you, haven't they? Okay, go on.
yeah, we are wired in a way that you have to set the woman in motion before the action,
Yeah.
Okay.
She
right?
has
So
to
that
be in
her
the mood.
juices can flow. You don't just come, handle her like a transistor radio, FM, AM. You're looking for frequencies, you know, you're
Yeah.
touching the nipples here, and then you go slam down. See, without the penetration, you using your fingers immediately into the woman's vagina will cause trauma. So you just have to explore a whole woman's body. A whole woman's body is work, is a body of work. So let the juices flow, and with that, you will help her to heal. And then she mentioned yoni massage.
Yes.
I think a lot of men should learn that. I keep posting how you could touch the labia,
The vulva
the
area.
vulva area, how you keep your
clitoris,
fingers,
yeah.
and this will come with men. Please keep your fingers shut and your cuticles off,
Yeah.
right? And wash your hands. That's how you touch the yoni, and you will heal your woman of vaginal trauma. She does not even need to go to a therapist.
She doesn't even
You
need to go to
will.
any medication.
Yes, you will
Simple.
heal her just the way you touch her. You could heal her. And then when it comes to vaginal trauma via childbirth,
Good.
right? See, that one is very, very emotional. Like there's been an episectomy,
Yeah.
and then the head of a human pass through you. I did one vaginal birth, and I said, no way. Please cut me open and take out the children.
It's really critical.
So because it was something I didn't. I think I recovered from CS birth faster than I recovered from my vaginal birth because of the trauma I went through. So
You mean your recovery, your vaginal recovery?
Yes.
Not your entire recovery.
No, not my entire recovery, my vaginal
Yeah, so
recovery.
specific
Yes,
with
yes, thank you. So for the healing part, it depends on what you do, on how your body is wired, and also on how your mind is wired. First thing first, you see the sitz bath that our mothers used to do. A lot of people say, oh, are you cooking yourself? Do you want to make some stew in there? It's very healing. I could sing it on the rooftops. Once you notice that, okay, after childbirth vaginal steam, it's healing. It's like setting the muscles in place and healing you of that trauma that you've had, even when you have a CS birth.
Yeah.
Okay, because here carried the whole thing. You've gone through trauma throughout the 9 months of your pregnancy, and then when maybe you and your husband you had sex and he was shifting the womb. Let me use that slang. You know, some women will say, "I want somebody to shift my womb,
Tear it apart."
Yeah. You know, and then
Brutalize the
another
place.
way women get trauma from normal sex, consensual sex, it's through some kind of positions. The sitting position actually causes you trauma.
Yes.
Right. And even the doggy position causes you
Missionary
trauma.
as well.
Yes. If you don't know how to dip your waist properly, you are going to have trauma. You are just like that. Learn how to dip your waist.
And that was how she was dipping
And
her waist when
sometimes
she
you
was sitting.
end up, let me just add to what you just saying now. Sometimes you end up bleeding.
Yes, you
because
end up
of
bleeding.
the way you position yourself.
So what first is for you to, when you notice the pain, the bleeding and stuff, please do a sitz bath.
Yeah.
Like I came with a sitz bath for you to see. You sit on hot water. Okay, let me use the local balance. Sit on hot water. But there are some herbs that are healing.
And sprinkle some salt on it as well.
If you want it faster, you get some herbs
Yeah.
that are healing, and then you sit on them. They're going to go in there. The steam, they take in some oils there for you for them to help heal your vagina. So it's dependent on the woman. Some women were like, oh, it's just there. Sometimes you will just have normal sex. The foreplay was okay and everything, and then when you go to pee, you feel pain. Then you know that your vagina has gone through trauma. And then maybe you pee, you did not have pain, and then you get up, and then you feel some kind of pain when you
cramps
see
or
something.
something,
And then your vagina has gone through trauma. So first thing first, do a sitz bath. And then if the man knows how to use his fingers and do vaginal massage. I do vaginal massage, but not for free, please.
Yes.
For healing.
Oh, you do vaginal massage?
Yes,
It is
vaginal
called yoni.
massage.
You know,
Let
the
me- it's
technical
like a yoni
term.
massage.
That's the
yes.
technical
That's
term.
the technical term. But let's
Yoni
for
massage,
the
So what you're saying right now is that you touch other women's vaginas.
yes, that's what my husband.
And there is also a health benefit to those things.
So strange.
There is health benefits on those
part of
things.
the
Yeah.
world.
No, I have heard, but I feel like
Yeah.
I mean, but for a woman to be touching, and I don't know, it feels.
Oh no, there is
doesn't it feel
and
weird
there
to
is a
you?
lot of health benefits on
So
that
imagine,
kind of
Dr. Azu,
massage.
you would go for a massage on your
Yes.
penis and it's done by another man.
That one is called the lingam.
Wouldn't you think it's weird?
For the men, it's called lingam massage.
But would you
they
no?
do.
But
You know, they
no,
go
wait,
through
but would you
trauma
think that
too.
is weird? Would you? No, tell me something.
Anyway, I get what you mean. Even a normal massage, I wouldn't want to be massaged by a man.
Because it's really
Because-
weird. Because it feels.
No, but you can still have the yoni massage, but a man will do the yoni massage for you.
But a man can do the lingam. Lingam is a prostrate-like massage, so
Yes.
that is
and
very
so-
good.
So
yeah.
when you say a prostrate-like massage,
Very
you mean
good.
you mean that a man is like is more the penis area?
Let me
No,
throw more
no.
light on it.
No,
When
let
we
her
talk
do it.
about
Okay, tell
when we
me.
talk about the prostrate massage,
Right.
it's being done in the goy area of a man, whereby the two testicles must be massaged. This kind of massage helps you to dictate if the person has a prostrate cancer. As a matter of fact,
And
in Ghana
testicular
here,
cancer.
yeah, very good. In Ghana here, I have discovered 101 prostrate cancer in man here in Ghana through the lingam massage.
So what you're saying
Yes,
is that
please.
you massaged these men's balls,
yeah.
course.
right?
There is a cord.
around.
Now listen, there is a cord that is linking to the anus. Those
Right.
areas needs to be massaged.
Okay.
You see?
Interesting.
Then you turn the person down. There is a way you massage the penile cup down to the vein down there. I don't know. I don't know. You guys need to
Give me a high five.
like I really need to teach you people things. You understand?
Interesting.
So we search massage. We search massage. It helps the man
Right.
to know his health status. Yeah.
Right. Okay, so
Yeah.
Tazu, can I book you a session?
And don't forget to, it also makes us to know if your sperm is healthy. You know there is
Are you up for a session?
you know there is what we call pause in the sperm. So people don't know about that.
People
was
don't know
that?
about that.
Pause in the
Okay.
sperm. Sperm do carry pause.
Right.
But people don't know about that. But through those kind of massage, you discover that this sperm is not healthy. There is a pause in the sperm. Hence, this kind of massage save lives.
So, I'm sorry. So when you say that this kind of sperm is not healthy, are you
Yeah.
saying that the sperm comes out through the massage?
Through that
of course,
process,
that
it
will
has to come
ejaculate.
because that is
so
the
when
main.
you touch the man and then he
He
will
ejaculate,
ejaculate.
yeah.
Yes. Then you test for the sperm.
No, I'm sorry. I
Then you
need to
test for
understand.
Is it new to you?
It's not actually new.
Not that it's new. I just find it interesting
Yeah.
that, you know, like,
Maybe
you
we
know,
should talk more next time about
pelvic
male
and
reproductive.
yoni massage.
pelvic and yoni massage.
you know,
Yeah.
we've talked so much about yoni. And a lot of, I keep shouting. I say, men, learn how to touch your balls.
Yes.
Learn how to massage
I think
your balls.
the next
and
is
then
you should try and put
yes.
prostrate cancer.
And then women
it's
should
too much in
learn,
the society.
Women should also learn how to massage their men's
Very
balls.
good.
Right? Yes, because it helps. And also men learn how to ice your balls.
Ice.
Can I
Yeah.
just give you a half five again? That is the spirit.
Ice
Yeah.
your balls. You know, another healing method for yoni massage and for the lingam thing in men is that, please, sun. Face your vagina to the sun.
That's all.
What was that?
Sun your vagina.
Sun facing, like
Sun
you face-
facing. It's called sunbathing.
Yeah.
Like the early morning sun. You come
Just-
out. Or you could be in your room. If the
And
sun comes
remove
through
the
your
curtains,
window, you
yeah.
pull the curtains apart.
Yeah.
And then you just open your yoni or your balls to the sun. Animals
Very, very-
even do it.
Very, very
It
important.
makes your sperm healthy and it makes your vagina healthy.
And that is where you where you receive the
Interesting.
natural.
So you open your legs to the
Yeah.
sun.
Yes. It's called
it comes.
sunbathing.
and that is where you receive the natural
Vitamin D pure into
inside
it without the
the body,
supplements.
without any supplement.
And it's
Right.
very
Yeah.
healing. Yes.
And it goes through your vagina.
Yes. Yes,
Vitamin
please.
D
Yes.
goes through your
yes,
vagina.
goes through your vagina.
When you say vitamin D, you mean the
The
sun?
sun, yes,
Yes.
the early morning sun rays,
Yes.
the orange one, and then you could also do it in the evenings when it's
Right.
orange, the
Yes.
sunset.
And
You
it's
do
very,
the
very
same thing.
important.
It's very, very healing.
Right.
Seriously.
Interesting. You know,
Yeah.
for me, well, every time that I was saying vitamin D, I was actually talking about something else. But anyway.
Yeah.
Anyway, so after the trauma, right?
Yeah.
Will that mean that when a woman is having sex again, she'll experience pain? Or will she have healed completely that it will be painless?
Yeah, so I need to say that, you know, depending on the trauma, like I said, we have first degree tears, second degree tears, and if it's a first degree tear, a normal tear that you have just on your mucosal lining, it doesn't go deeper into the muscles.
Okay.
So this type of tears, you get it during normal sex. You have vigorous sex,
Okay.
and you get these minor tears.
Okay.
There's the magic, and this is what it does. In the healing process, right, there we have collagen that is being produced, which makes the vaginal walls even stronger. You understand? And so once you heal, the vagina becomes stronger and more tighter than it was. You understand? And so there is a saying that people, there's a sexual myth that, oh, if you want your pussy to be tight, then it means you have to stay virgin. You know, if you don't have sex, it means that your pussy is going to be
contracts back,
tight.
yeah.
No, it's a fallacy and it's a mistruth. The more
Okay.
sex you actually have, right?
The tighter your vagina.
Yeah.
Tighter.
You understand?
The muscle keeps
The muscle keeps
The muscle keeps
contracting.
contracting.
Yeah.
You understand?
Yes.
Yes.
Really?
Yes.
Yes.
We said it
Interesting.
Yes.
You
Your
know?
muscles
Actually-
because and again, make sure you have orgasms.
Yes.
Really?
Yes.
And
So
the
take
moment
this.
you have
Yes.
orgasm, you notice that after you
Exactly.
finish having the orgasm as a woman, you started feeling this.
Like it goes like this.
It goes down there.
In that you feel it.
You feel it. You
Yes.
know that it
Yeah.
is contracting.
Yeah.
And the pussy tighten back.
Yes.
That's
So
it.
let me explain this to you.
Please do.
You know, when you talk about, you see a man going to the gym, he is lifting,
Weightlifting.
weightlifting, it's against resistance.
Right.
If he takes a lighter weight and goes, there is no resistance.
Right.
And so there is no tears in the muscle fibers.
Right.
Because there is no tear in the muscle fibers, the person is not going to gain any muscle.
collagen, yeah.
Right.
But if he picks a bigger weight, it causes strain, it causes the tiny muscles fibers to tear. As he goes back to sleep, that is when the magic is being done. That is when the healing process happens. And then more collagen is being produced, the muscle fibers become bigger and bigger. And that is what happens in our vaginas when we have sex.
Interesting.
Yes.
And so when you have sex,
Because I'm here thinking that the kind of women who actually would have their vaginas tight might be the I'm sorry.
You are right.
Yeah,
no,
go
no,
on,
you are
go
right.
on.
Yes,
Yeah.
you are right.
Yeah.
So I take someone who has been having regular, frequent sex,
Right.
right? And
So
then I
for
take
instance,
a Catholic
yeah,
man.
for instance,
and I
a
take
sex
a Catholic
worker.
man or a reverend sister.
So for instance, a
For
sex
like
worker
a sex
Yes.
worker, you can't even
would
compare
actually have
with
a much tighter
A tighter
vagina.
Of course,
yes.
yes.
Than someone
a
who-
woman
So, say
who's
a reverend
getting
sister.
because Debbie, you are doing exercise
You're
inside there.
exercising
The more
your
exercise
vagina.
you do there, the more stronger the vagina was.
That is why I would tell
Yeah.
couples have sex at least 4 times a week.
Exactly.
as a man,
So
23 times in a month.
Oh, you are making
Yes.
it 23.
So you go and check your medical book.
No. In
23
medicine,
times in a
fact,
month for a
you are
man.
right. So in medicine, we say
Yes,
that
in medicine.
it should be every other day, at least.
Once
least.
a day.
At least every other day. If you come into the hospital facility, you come and tell me that, oh, doctor, I have not been having children.
sex.
Yeah.
No, I've not been. I mean, I want
Children.
to have
Then you ask how many
children. And
times?
The first thing we have to ask is, how many
times
times have you been having sex?
That's it.
If you have not been having sex at least every other day for 1 year, we'll tell you that go back and do it every other day for 1 year before you come back and tell us that you cannot have a child.
Okay, so on the note of that, we're going to have to take a break. I think tonight I'm just hearing certain things. I think for me, the thing that has stood out definitely has to be, opening my legs to the morning sun. Yes. I think I should start doing that. This is Duvet on GHOne TV. My name is Natalia. Do stay tuned. We will be right back. All right, welcome back. This is Duvet on GHOne TV. My name is Natalia. Definitely a great time in the studio having this conversation. Before the break, I'm sure that you heard so many things, including icing your balls. Princessa and Chelsea both have said that it is important that as a man, we put ice on your balls. Every now and again, or how often?
Every 2 days.
Every 2 days.
If you could even do it every day, better.
Okay, put ice on your balls. And what would that do?
One, it strengthens your sperm.
It strengthens your sperm.
Yes, and it also gives you high stamina.
Okay, so there you have it. That is the conversation we're having tonight. I have Dr. Azu, I have Chelsea, and I have Princessa. Very interesting conversation. Now, before the break, I mean, obviously, I'm a little overwhelmed. I'm sorry. The information is a bit, but I'm taking it all in, right?
Yeah.
Now, let's talk about the psychological impact.
Yeah.
Okay.
Yeah. Before we talk about the psychological impact, I would
Okay.
want to explain more on the ice.
On the ice.
I'm sure a lot of men are be like,
Ice
why
on the
am I the
balls.
one icing my balls? Come on. How can I be icing my balls? You see, there's a reason why your scrotum is outside of your body. You understand? Because of the temperature.
Okay.
You understand? That is God's own natural way of doing it and ensuring that the temperature there is lower than the temperature within your body. So if, for instance, you check your body temperature, it's whatever you get is lower than the temperature in your scrotal area.
Okay.
And this goes to explain to men why we encourage men not to wear tightening pants.
Okay.
You understand what I'm trying to say? Because if you wear tightening pants or pants that are basically made of nylon,
Very good.
it traps in heat,
Produce
makes the
more
place
heat.
hot, and makes your sperms less healthy.
And it also
Right.
made the
You
skin.
understand?
It also made the skin irritating.
Yep.
And it also makes the
Hence
skin
causing
irritating.
rashes.
You-
Yeah.
You understand? So that is the reason why we say wear loose boxers that would ensure that the place is what is aerated.
Okay.
You understand? And you continue to get, because once you do that, your sperms even become more healthier.
Right.
And if you see healthy sperms, you would know that this is healthy sperms. and
Please
this
tell
is not
me, how
healthy
would you
sperms.
know?
No.
You know?
Can I chip
Oh,
in
yeah,
now?
you can.
yes,
I
please.
can,
I'm specialized in
I can
that.
hand over to
Yes,
our
please.
specialist.
How would you know?
How would you know if a sperm is healthy? Number one, first, which is the normal thing, the appearance.
Okay.
Second, the smell.
What is the appearance? What should
Now-
it look like?
Now, a healthy sperm, supposed to be very thick, very thick, like a mucus from the nostrils, very thick.
As soon as it is released.
As soon as it is released,
Yes, it
it's
should.
supposed to be very thick. Of which, when you touch it like this,
it's sticky.
It's sticky, very sticky,
Okay.
and the color supposed to be a bit bright.
Okay.
Bright. I can't say too bright, but bright. Then when you
You know,
smell
there
it,
are some things you can't
now,
describe.
Yeah. Now when
Yes.
you smell it, there is a smell from a healthy sperm. It's very accommodating.
Yes.
Yeah, like you can even use it for facials. Yes, I want to put that. A male sperm can be used for facials. It clears the face, clears the pimples, everything. That's the healthy sperm, yeah. And it's clear stretch mark as well. So now, when you touch the sperm and it's very thick and you smell it, the odor is okay. But when you want to see the one that is pus inside and the one that is infected, colors change and it's become a bit loose.
Watery.
Very good, watery. Then when you,
Smell it.
my goodness, it's something off.
Let me come in.
Come in,
Chelsea.
please, help me, yeah.
For like 2 days ago, I wrote something on Facebook about men and their sperm and their balls, right? I'm like, we've put it so much on women that we prepare ourselves, we are steaming, we are getting ourselves ready. Women are drinking okra water, pineapple water. Whatever you eat as a man affects the state of your
The
sperm.
sperms. Yeah.
Right on.
Whatever you put in your mouth is going to affect the state of your sperm. You'll see some men who take so much alcohol, they will take so much junk food, and now the bane is the energy drinks. It kills your sperm gradually.
Serious.
It does kill your sperm. And then men should learn how to take pineapple juice. It gives your sperm this vitality and a very good smell to it. And also, when we talk to men about them taking care of their balls area and everything. You know, you talked about tight pants. Anytime I see men on tight, skinny jeans, sometimes I go out of my way to tell them, you're killing yourself. Yes, because let me tell you, a woman's conception is determinant on the kind of sperm a man has.
Yeah.
Most miscarriages is not caused by the woman, it's caused by your sperm, because a woman's body is built to flush out any nonsense sperm.
Unwanted
Yes,
things,
if your sperm is unhealthy, the woman might not get pregnant if she has a healthy body, because her body is created to take out any sperm that has a wrong DNA.
Yeah.
But if the woman's insides are not healthy enough, her body will take it. But you see women having miscarriages here and there, go check, is the man's
It's
sperm.
a man's fault. Yeah. All
Is
this
a man's
low
sperm.
sperm count, all those stuff.
And then smelly sperm, pus in the sperm, low sperm count, and all that. And then if you also take care of yourself very well, you find out that when we have children with chromosomal disorder, it also comes from the sperm
And the sperm.
of the man.
And
It's
remember, the woman released the egg. Egg is an oval shape. So anything that makes the egg deformed comes from
it
the
comes
man.
from the man. So
Yeah.
Because
So-
a sperm contains a lot of cells.
Okay.
Yeah.
Yes.
Dr.
So
Azul.
I agree with you on most of the things that they are saying.
Right.
But then when you talk about, I just want to add on a few things before I
Alright,
come to
then.
where I disagree with.
Okay.
You know, so once the sperm is released, you expect it to be thicker. But
Okay.
if it stays
For some
After
time.
a while.
Yes,
then
it breaks.
becomes watery.
Watery, yeah.
Right, so that's very important for you to also
Okay,
know.
to know.
Yeah, then in addition to that, like what she said with regards to the miscarriages are nature's own way of bringing out children or fetuses that are not healthy. You
Right.
understand? And the fetus or the embryo, which is when the two come together, is made up of the sperm and the egg,
Right.
right? And with the egg contributes 50%, and the sperm also contributes what?
50%. Okay.
You understand what I'm trying to say? So the statement with which she said that when you look at miscarriages, most of it are coming from men, I would want to say that that's not really a factual statement.
Okay.
But then you can have it coming from deformed sperms. First of all, in most cases, a sperm that is unhealthy cannot even fertilize
An egg.
An egg,
an egg.
yeah.
So where you have it mostly coming from the man is in infertility cases.
Right.
Yes,
So-
that's what I meant.
So,
No.
so
okay,
it
you put
won't
it
even
you put it in the
fertilize.
medical way.
Yeah,
medical-
Yeah,
no, I just
because-
because of
Yeah.
Anyway, I'm looking at it from the medical
medical
eye.
Medical
aspect,
eye,
yeah.
yeah.
Because you said when you look at most miscarriages, it's coming from the man. I just
yeah.
wanted to correct that because before a miscarriage happens, then
There's a-
fertilization
Exactly.
Has already
Has already
taken
taken
has already
place,
taken
yeah.
place. But if the sperm is unhealthy,
There won't
it
be
is
fertilization.
unable to fertilize.
Okay.
Okay.
So a lot of people blame the women for infertility issues. But for all you know, most, that's where the statement is now coming in, come from the man and not just only
The woman.
the woman.
Okay.
But in cases of miscarriages, that once there is that combination, a lot of things happen, either from the environment that they are in or chromosomal defects. Then the body itself would bring it out.
Okay.
Sorry,
Yeah,
can I
exactly.
contribute? And that is
Yeah.
why you see some female, they have this acidic vagina.
Vagina,
This thing.
yeah.
Sometimes if you're a lady and you have this acidic vagina stuff,
Yeah.
it sometimes delay pregnancy.
Yeah.
That is why the medical doctor will ask you to eat something to make that place alkaline-like.
Exactly.
So I just want to support that
Yeah.
as well.
And-
so
and another thing,
acidic vagina
vaginas,
can really
yes,
delay
can
getting
also kill
pregnancy.
sperms.
Yes,
And
thank
also
you very
contributes
much.
to what she
Contributes,
said
yes.
with regards to what you
What
eat.
you eat.
What you
affects
eat as well.
anything.
It also applies to women.
To women,
Yes.
yes.
As well.
And
Yeah.
then popping of antibiotics into your mouth at every
Yeah.
issue you have will also mess up your vagina.
Yeah.
A lot of women have bacterial vaginosis
Yeah.
because they pop, every little itch, you pop antibiotics. Any little itch, you pop antibiotics. Normally, even when prescribed by the doctor, when you go to you run a test and everything, and then your doctor will tell you, drink lots of water
That's right.
when you're taking the antibiotics, because normally even the prescribed one will cause thrush, will mess up the flora in your vagina. Your vagina has a flora, just as a sperm also has a flora. She was talking about it has a particular
Yeah.
smell.
Yeah.
The vagina has a particular smell.
Yeah.
That smell, that's why I don't even advise women to use
soap-
scented
soap
soaps
down
down
there,
there.
yeah.
Douching.
Yeah.
Yes,
Yeah.
and all
Yeah.
that. No, I don't advise you to do that because it will mess up the design. You say, I want my vagina to smell sweet. Eat a lot of fruit.
Food. Yeah.
Eat a lot of fruit. Your body is going to take it down there and make it smell sweet. But if you're every little thing, you're throwing lots of garlic into your food, lots of ginger into your food, my dear.
What's wrong with garlic?
You're going to smell that way.
Yeah.
You're gonna smell like
You're going to
garlic.
smell garlic.
Yes, because the discharge you're gonna be discharging down
Yes.
there will be smelling that.
Okay,
So
let's
whatever you
eat
eat, the end product comes out.
to
Yeah.
whatever, even in your sweat.
Yeah.
it
Whatever
does
you
that.
eat
so
comes
for,
out.
For the ladies, I would say, look, sometimes you could heal yourself with what you eat through your reproductive organs. A lot of beetroot, a lot of zobolo. Zobolo, I'm not the one you buy on the streets. They've added a lot of
No.
additives. Get zobolo and
The leaves,
sip it
yeah.
like a tea and drink. Zobolo is so good for women.
Yeah.
And also normalize taking water, warm water, first thing
In the morning.
morning.
Yes.
And then the sanitary pads you use, tampons. Now we are coming back to the vaginal trauma. inserting of tampons, do you know it causes shock?
Serious.
Really?
Yes.
Explain.
You put in the tampons inside of you. You know, the next thing, they have a lot of chemicals they use to make it. Anytime you insert something into your vagina, it collects. Yes, the vagina collects, takes it in. It will contract around it. And these things they've used to prepare the tampons goes into your bloodstream. The vagina has muscles and blood vessels all around them there. It goes straight into your bloodstream and it might cause you shock. Another thing, it might also cause you trauma because sometimes you won't even set well as it is written. You should lie down and everything. You will just put it inside. You're causing trauma to your vagina. And then using scented sanitary pads also causes trauma to your vagina because the vagina does not need all those things. Get organic pads, pure cotton, and do it. And most of the times, use your shower head.
Please.
Please.
It's very important.
Apart from it just being cleansing, it's
Yes,
orgasmic.
It's orgasmic.
Use your shower head, you know?
Yes. Use your
And
shower
I think
head.
every woman at this point knows about the shower head
Yes.
Yeah.
and the magic that comes with it.
Yeah.
Yes.
Sometimes
Chelsea.
Chelsea,
I
why
normally
you
come
reminiscing?
multiple times all the time. I don't know what's going on.
Hey, madam.
So, I mean, for anyone who may not understand what we're saying about the shower head, Chelsea, do you mind explaining?
Okay, actually, me, for example, I always like demonstrating. You see, when you're taking your shower, right, and you on the shower head and you bring it down to your vagina, especially if you're having this big clit. Is it clitoris, right?
Clitoris.
If you're having this big something, you put the shower head on the steps.
Yeah.
Oh my God, the feeling is something crazy. Like it's something crazy. Before you know what happened,
But
It will
then,
give you an
like, oh my God, you're
but then
getting
you
there.
have to also increase the pressure.
Yeah,
That is
pressure
it.
of
The
the
pressure
shower head.
becomes so vibrating and you put it close to the place. Oh my goodness.
Yeah, already having orgasm. She's shaking.
I'm already shaking. You see, I'm shaking. Before you know what happened, you've come. No,
So I'm
you've
sure
come.
You know, and that brings us to what we call mind orgasm.
Wow.
You
Yeah.
understand?
Tell me about that.
You know, mind orgasm.
Mindgasm.
Mindgasm,
Yes.
right? You are just sitting down there. You take yourself somewhere, like what Chelsea is doing. She's taking herself there.
I'm already gone, cry. I'm gone.
Right.
And then she experiences it in the physical and in the
physical.
normal
Right.
normal state.
Would you say it's also the thing that sometimes people do it when maybe they want to touch themselves, like you're by yourself and you're thinking to maybe touch yourself, but you're imagining whoever.
Yes, you can.
Yeah.
Of course,
Doing
of course.
that with.
Yes,
Yes,
you stimulate,
because
yes.
it's your mind.
Yes, it's your mind.
Your mind is your biggest sex organ.
Exactly. I was just coming to say that.
It's your biggest sex organ.
Yes.
Because
Yes.
it all is all in here.
Yes.
Let me say, for instance, right now, that's what I said. It's like he said, the healing is individual dependent. Some people want to say, yes, I just want to heal from this trauma. Like apart from the shower head, there are some somatic exercises I do with my patients. That's what I actually wore when I was coming. I said, okay, let me wear trousers. It's simple. Pelvic opening. That's how you squat.
Okay.
And
Do you want to
spread your
demonstrate?
legs.
Do you have
Yeah.
your thing at your back? Can you move?
Yeah.
Yeah?
I could move to this side.
Oh, maybe you
Okay,
can
no,
stand.
right here, right here,
right
so
here.
that if
Yes.
the cameras can. So
Like-
you squat.
For instance, yes, you
Okay.
squat.
Okay.
You know.
Yeah.
You squat, and then you spread
Your legs.
this way.
Okay.
Or you squat like this.
Uh-huh.
Oops, my mic is down.
Okay.
You squat, and then you hold your feet, open
Right.
it wide.
Okay.
Are you getting me? Oh my
Yeah,
God.
yeah, they're getting you.
Yeah, they're
And then
getting
you
you.
open your legs
You
wide.
open your legs wide.
Uh-huh.
And then there's another one you go like this. Like you stretch this your leg and then you go 1 and 2
Okay.
and then 1
Okay.
and 2. It works with your muscles down there.
Okay.
You take it back
Right.
and then you do the same thing. Now, when I talk about the doggy style for dipping, you go down.
Chelsea, you would have to help her
Help me
grab
with
the
mic, please.
yeah,
Thank you.
exactly.
Okay, you go.
Yeah.
This,
Six, one more.
Yes, please. We're going to have to do the demonstration.
Okay, now
sorry.
this is for your healing.
Okay.
You go like, see, I'm kneeling, then I spread my legs.
Right.
And I do, I'm having my shoes on.
Okay.
You do the butterfly pose.
Right.
Spread your legs, you do the butterfly pose. Like,
Okay.
See, I'm going down.
Down, okay.
You do the butterfly pose, you suspend, and then you breathe in, count 1, 2, 4, hold it,
And then
exhale.
you let go. Okay.
Then you let go. When you're doing it, you breathe in from your tummy,
okay.
up,
Okay,
and down.
down.
And then you find that you find that your vagina will be pulsated.
Right.
Right. And then another way is you come like this. Now, this is another position, this with sex. If your husband or your partner, you want to heal from vaginal trauma, this is it.
Are you going to bend
Producer,
over?
yes, I have to bend
You're going
over.
to bend over. Okay, we like seeing women bend over. Please bend over.
Okay. Chelsea,
Okay.
you're going to help me.
Okay.
Okay.
Right.
This is...
How do I help, please?
Okay. Are you going to bend over in the
I'm gonna
sofa?
bend over
Okay, go ahead.
in the sofa.
Okay, go ahead.
Right now, when I say you hurt yourself, when you bend over like this, you're hurting yourself.
Right. With your
This-
back straight.
With your back straight.
Okay. Then you hurt yourself. Okay.
When you go like this, your knee,
Uh-huh.
and then let me bend over like
Okay.
this.
With your knee.
With your knee, and then you dip.
Oh, right. So you dip your...
Here
so you-
Goes down.
dip.
Right. Okay.
Right? But if you are slim, if your weight is lesser than 65 kg, please put a pillow underneath your
your pelvis area.
So
Okay.
you go like this, and then you dip this
You
way.
dip. Okay.
I get it.
So that you yeah.
Then your head goes down.
Right.
Like this.
Yeah. Yeah.
And then the man comes from here
Right.
over. Slow trusting.
Okay.
I don't know if you get it. Slow trusting.
Okay.
Slow and with that dipping, you could now start doing the Kegel exercise for your healing.
Right.
Slow trusting, Kegel exercise with the dip. And then before you dip, let your knees be wide apart
Okay.
like this, because
Okay.
it's still like going
Right.
like this.
Your knees are wide apart when you dip.
Yes.
Okay.
And then another thing is the man can be below. It's also helping. You do the same thing. Knees wide apart, and then like this.
Right.
You sit,
Okay.
and then you try to do what I did with your knees.
Okay.
Pulsate, pulsate, up, down slowly, pulsate, pulsate, and then you move forward, like go. Dr. Please.
Okay.
And then you go forward, slowly go forward, and then close your eyes and imagine yourself healing,
Okay.
right? And the man, please don't just stay there and say, "Oh, she's healing herself."
cool music
No.
to go with it.
Thank you. Dim light.
Very good.
Please put on socks. Ladies, keep your feet warm. If you want orgasms, keep your feet warm. When your feet are cold, orgasms will be difficult. The man should have his hand here, just here,
Okay. On the waist.
on the waist.
Okay.
And then here, you massage. While she does the dip, go forward, down, pulsate, pulsate, and then you go, you wind.
Right.
You go, you wind.
Okay.
Then like that.
Thank you.
I give you 5 minutes. You
It will
have
come together.
healing orgasms.
Okay.
And then
Okay.
we'll
Hold
come
on to
together.
the.
Okay.
Wow.
All right. That's very interesting.
Very interesting.
Very, very interesting. I think that we're going to, yes, great job. We're going to have to take a break. This is Duvet on GHOne TV. My name is Natalia. You just saw Princessa demonstrate on how to heal. Healing is in your waist, she says. Chelsea also is in the studio, as well as Dr. Azu. Do stay tuned. We will be right back. All right, welcome back. This is Duvet on GHOne TV. My name is Natalia. Before we come back to the studio, let's take a look at what our sex position of the week is. Do stay tuned. Orgasmic role reversal. This is to be performed when the woman is unsatisfied and still full of the water of love. The Ananga Ranga recommends it for times when the man is exhausted and no longer capable of muscular exertion. Although today, many couples would make it their position of choice. Men and women love on-top positions for their thrilling raunchiness and the power to stimulate. To get into position, she straddles his body with her feet flat on the bed and guides him into her. For him, she is free to satisfy him in any way she likes. She can bob up and down on his penis, rock back and forth, or squeeze him tight from inside. For her, an orgasm is almost guaranteed for her because she is in control of the angle, depth, and pace of penetration. It's raunchy because it gives men the thrill of immediacy. She simply straddles his body and takes him inside her. Then, if she turns his penis by making circular motions while moving up and down, he will find the pleasure mind-blowing. All right, so that is the orgasmic role reversal. And I like the way the woman's back is, there's a thing about it. That's as
that's what Cesar was
trying to
describing.
demonstrate.
Exactly. Because you need that bend.
That bend is very important.
That bend is very important because anatomically, your vagina is this way. And then bends into the womb.
Right.
And then the womb now sits on your bladder. So when you turn in that particular position,
it makes
you
it easier.
Open it up and make it horizontal. So it is easier for the thrusting to occur.
Right.
Then again, you have the clitoris also just there. And so while you are thrusting, you are hitting it very well at the right spot.
Very interesting.
So that bend is very, very important.
Very important. So, but what would you say about this position, though?
So this position is similar to, the bend we are talking about, and ensuring that the woman has control of what is going on.
I think this is called cowgirl.
Reverse cowgirl.
Yeah.
No, not reverse cow, not really reverse cowgirl, but it's similar to reverse cowgirl.
Right.
Okay.
But
the name of this position is orgasmic role reversal.
Yeah.
Okay, orgasmic role reversal.
Yeah.
Okay,
because in reverse cowgirl, the thighs
has to be up. Yeah.
Up,
You understand? But in this particular position, it's lying down.
Okay.
But what I want to say about this particular position is that the woman is in control.
Right.
If you are having sex and the woman is in control of the sex, you enjoy it more.
It's much better.
It's much better. Because your goal is to satisfy the woman.
Right.
You understand?
So once she takes control.
Once she takes control of it, she knows how to trust, she knows which position to move better, and she knows how to turn. And you, the man, you are there enjoying the gogomi movement.
And it makes the man to come faster.
Right.
No. When the man, it may make the man come faster, but when you know you're about to come, then you quickly tap and change position. And delay it slightly.
You flip her around.
You flip her around, you understand?
Yeah.
And the process of flipping around delays the orgasm.
Chelsea says, "Hey, are you still doing the mind gasm?"
You have the PhD on that.
I have a PhD.
Serious.
but Chelsea, what would you say about the position, though?
Oh, actually, this is very nice, but this is not my favorite sex position, actually, though, because I love doggies so much. I like it when I bend and you hit. Oh my goodness, let me not talk about that. So this position is really, 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 really mind-blowing, actually. Yeah, that's what I can say.
Cesar. Just right after your demonstration, then we see this position. So what do you have to say?
You see that position, yeah? It's something, because I like being in control.
Okay.
When I'm having sex, I have this mind that I'm a goddess.
Yeah, you are a goddess. Women are
You are
goddess.
actually a goddess.
So that's why, some people might say, okay, I'm kind of a dominatrix. No, but I like to be in control when I'm having sex because, like, I want to control the cosmic of the man. So this position for me is one of my faves. One of my faves.
Okay.
Yes,
That's interesting.
and it's very healing because it's also a somatic exercise that we see there. It's opening up the hips, and then all the stress maybe I've had during the day is just going away.
I think I need to
Just
try
going
that.
away. Yeah, you need to try.
I need to try it.
And you see the way the guy was touching. That's what I was talking about. He's also helping.
Yes.
Right.
Yes, because here where he's touching, the butt area is very, very erogenous for the woman,
Yeah.
and you're touching it lightly. Please don't grab it.
Softly.
Softly. It's very, very orgasmic too.
Yeah.
And
Okay.
I also need to add that, you can have various variations of
Yes,
this.
of that.
this.
Yes.
Okay.
Man lifts slightly,
Okay.
and then once you make good use of your fingers, the fingers can also go around
Go
the
around
clitoral
the
area
yes, just go
to
around.
also
Yeah.
Give
massaging
full
and
body
all of these things.
orgasms, not just
Yeah.
clitoral
But-
orgasms.
For the woman, when you are going to do this, you need to also make sure that you are very clean.
That's what I was
Right.
about
You
to
understand?
say. Cleanness
And
is
very
important.
similar to doggy. A lot of women, you don't clean. You think that you are only cleaning your vaginal area, but you forget that the
say
vaginal
that
area
again.
is very close to the anal area.
Yeah.
And you don't want me to give you doggy and then the anal area is not well kept.
Yeah.
Yeah.
It is so disgusting, and it can cause the man his penis to become flaccid in a
Flaccid.
second.
Turned
In a
off.
second,
You understand?
yeah.
Completely.
So when you are doing this particular position, you need to also make sure that you are point on, well clean.
Okay.
Proper hygiene.
Apart from the cleanliness, Natalia, I want to tell women, you don't just take care of your face. You have facial cream, facial scrub. Please scrub your butt.
Yeah.
Scrub your butt cheeks.
Serious?
Have scrub. Like the scrub you use, take time to scrub your butt. There's something we call buttony, like butt acne. It's there. You scrub your butt and then also moisturize your butt, especially the butt crack and underneath your butt. If you don't moisturize it, they will get darker.
Yeah.
So when you moisturize it, they blend with your normal skin,
yeah, skin tone.
Yes. A woman might be clean everywhere, but you see those discolorations can turn a man off.
Of course.
Yeah.
So please, ladies, learn how to
Yeah.
moisturize. Like I would advise, your face cream should be used on your butt area, your butt
area,
cheeks area,
yeah.
because it's still the same skin
Yeah.
that you have on your face that you have
Same textures,
on your
yeah.
butt. Yes.
Yeah.
So you use it, you moisturize underneath your butt and on your butt crack, and also normalize scrubbing there and oiling that place.
Yeah,
That
but
area.
I must also just quickly add that be careful. For some of the facial creams are acidic
yeah.
and very irritant. Be careful; it does not go into the vaginal area.
Yeah.
Yes.
Because
some
the
of them are
skin
really
around that
highly
particular area is
sensitive.
very, very
sensitive,
sensitive.
yes.
So, in as much as you can use that area is
Yeah.
also very sensitive.
Just
so be
simply
careful.
use shea butter and like moisturize the areas.
Yeah,
That's
yeah,
that's
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 also
good.
one.
That's all that matters.
Yes.
Okay. All right. So let's talk about communication. For a woman whose vagina has been through trauma, how would you communicate this with your partner so that, let's just suppose this is in your past, right? You're moving into a new relationship or to a new partner. How do you communicate this so that they are able to know how to handle you? How do you do that?
Yeah, so in fact, you have given more like two scenarios here. If it is your partner and it is a normal vaginal cell, open, honest conversation with your partner is very key.
Okay.
You understand? We need to take a break. And the reason we are taking a break is that, you gave me very hard sex and I'm healing. That's
Okay.
going to make the man even
Yes.
feel much good
Yes.
and much better. You understand what I'm trying to say?
I call it sexual feedback.
Yeah, exactly. Yeah, sexual feedback.
Sexual feedback.
Then that's why I always say that you cannot have sex without the feedback.
Yeah.
Sex without resolution is not proper sex.
Of course.
During resolution, you are going back to the state in which you were
before.
And during that particular period, that is when you do the post-mortem analysis.
Yes, that's
Yes.
it.
You understand? That's when you do the post-mortem analysis of what has just happened. Be free and open
Yeah.
to allow your partner to tell you that,
tell you.
I didn't like the way you know,
That
I
is
liked
where
the way
communication
you did it.
is very important.
Communication is very important. So if it is your partner that you have been having frequent sex with,
Yeah.
I think you should just sit down and have your honest feedback. But if it is something that has happened in the past and you are still healing, I would advise that you speak to a therapist.
Thank you.
To guide
understand?
you.
To guide you.
Put
to
you on a
help
course.
you to heal.
Yeah.
They should come to me.
Yes. Come to Cessa. She is sex. You know? She is Cessa.
You understand? So another
she
thing again,
understands
I just
the
want
sex,
to
you
throw
know.
more light on what you are saying. You said this thing called communication is
Yeah.
very, very important. Communication actually saves marriages,
Yeah.
save lives.
Yeah.
So I think we ladies, we should try and have this conversation
open
with our
conversations,
our man. Do you understand? Take your time in. Even though, for example, you don't want to pour out, there are many ways to pour out. You guys can hang out, go chill. After chilling, be like, oh sweetheart, I want to tell you something. This thing is bothering me. Can you just give me a break for me to gather myself together so that we can continue? So communication, please. We should not leave it out. Like, it's very, very important.
Another
please.
thing about communication, I would say, it's that who are you communicating with? Is the person matured enough to handle the communication? I'm talking about the one from the past.
Okay.
As a lady, you should be able to discern who this person is. If the person is able to handle the communication, the information you want to give,
right.
about your past, please. Because sometimes what you say will be used against you one way or the other.
Not in the court of law.
Yes.
Yes.
One way or the other. So please be
Right.
discerning enough. Watch the person. Don't say, oh, I want to be open. See, there are some things that are better left unsaid. Like Dr. Zhu said, see a therapist. You and your therapist, the therapist is bound by oath of confidence.
Of course.
Even the therapist partner won't hear what you people have discussed.
Like your privacy is
Right.
Yes,
secured.
your privacy is secure. That maybe. And another thing I would say again is this: if you're married, like I talk about the sexual feedback with a lot of my clients when they come for couple therapy, is that don't have the sexual feedback in the process of lovemaking. It won't catch. Don't have the sexual feedback there. Let it be in a neutral zone when there's no sex
Right.
involved.
When we're not having sex, when it's just a regular day.
When it's just a regular day, look for when both of you are in a good mood. And like he said it, this is how you say it. Women, I want you to imagine, say it thinking you're wet.
Yeah.
There's how the words come out.
Yeah.
When you are in the mindset that you are wet,
Yeah.
your words comes out like fluid.
Of course.
But if you don't say it with the mindset that you're wet, it's going to come hard.
If you are angry,
yeah.
know that you shouldn't say it.
Yeah.
It's not going to
Right.
flow very
You
well.
understand?
If even not when you're angry,
Yeah.
sometimes I would say put yourself in that
mood.
that mood of
Yes.
wetness.
Yes.
You'll find out that your words will come out so appealing to
So
the man's
sweet.
ear.
So different.
Yes. So that's how you give sexual feedback to your partner about, see, like Chelsea said, like doctor said, man, you shifted my womb, cry. And I really need time to recover. I really need your help to recover. Can we do a lot of cuddling more? And you could say, okay, do you know what? I'll give you hand jobs. Okay, I'll give you BJs.
Of course.
All right. Men will be so excited.
And you see, I like how she has practicalized it.
Yeah.
That
Right.
even if you didn't hear or the brofo, you didn't understand the way she said it. Say it like that.
Yeah.
And we like it this way.
Yeah.
I like it like
I'll
that.
give you
We
a
like
lot
it
of
this way.
hands.
We like it this way. Yeah.
So
Interesting. And so vaginal trauma and vaginal rejuvenation. How do you marry the two?
So,
okay,
Chelsea, go ahead. No, go ahead. Ladies first.
You see, these things, they are different, okay? The vaginal trauma is like a painful experience, while the rejuvenation is like you renewing, healing, bringing back like bringing the vagina back to life,
Yes.
like a different process altogether. So hence, I don't know what to say
like
anymore.
let me just put it in
Yeah.
layman's language.
Okay.
Yeah.
Vaginal trauma is like where they use a hammer to hit a wall
Good.
and it broke. And then you are bringing plaster of Paris
To cement it down,
to put
yeah.
it, fillers and everything, and then you finish cementing it and then you paint it.
That's how it is.
vagina
Yes.
Rejuvenation.
Yes.
Add
Yes.
aesthetics.
Aesthetics to
Yeah.
it.
Yeah.
All that.
Okay,
That's
so the
it.
rejuvenation,
Yeah.
what does it involve typically?
I think that she has said all
A lot,
that she
a
has
lot,
said,
a
and all
lot.
that Chelsea was saying.
Yeah.
earlier.
Right.
There are aspects of vaginal rejuvenation.
Okay.
You understand? All of that. But there is also another aspect. But these parts are non-surgical aspects. of,
Okay.
you know.
Right.
We also have the surgical aspect. That is usually being done by surgeons.
Okay.
Where they, like she said, there is a big tear. Depending on the vaginal trauma
vaginal
that the person
trauma.
has.
Yeah.
Somebody gets a big vaginal tear and the healing has occurred, but then the healing has caused a lot of disfiguring of the vagina. Somebody had an accident
Right.
and had a cut that has disfigured. It needs to be repaired. It needs to be
Yeah.
rejuvenated.
It will need surgery.
It will need
Yeah.
surgery. This rejuvenation
Okay.
would also include all of that.
Okay.
Yeah.
Then again, we have people who they are older, they've reached menopause.
Yeah.
The
Prolapse.
vagina become lax. It become
Right.
loose, like we were saying. The vagina has elastin in it. And this elastin, with time, it's
When the progesterone goes
Estrogen.
down and estrogen
exactly.
goes down, in
It
menopause.
becomes lax. So when
Okay.
it becomes lax like that, and you still want to
To do,
we
yeah.
can
Feel
tighten
brand new
it.
again.
You can
understand?
tighten it.
You can
Yes.
tighten
Okay.
it. with
And that
certain
happens through
procedures.
surgery as
That
well.
Yes.
happens through
Yes.
surgery.
Okay.
But they are the natural, before we even recommend surgery, we
There
would
are
say that
natural
you have
ways
to
for
go
that.
through some of these things that she was talking about. The physical exercise, the dieting, the sitz bath, the
sitting
Kegel
bath.
exercise, and all of
Yeah.
these things. are
Like,
very,
let's
very
demonstrate the
important.
sit bath how they
Yeah.
could see. Like, this is a sit bath.
Yeah.
Okay.
This fits into your
So
toilet.
this is this on sale? Is this at the market?
Yes.
Yes.
Okay.
So this is sit bath. You could it fits there normally with a normal water system. And then you add your water in it. If you're healing the vagina here, you put your herbal teas, there's some herbal teas,
Yeah.
vaginal
Right.
teas, or just hot water and rock salt.
Right.
And then if it's hot water, please let the water steam come down a bit. Let it just be here. Not too high, so it won't burn your vagina. Let the heat come down a bit. And then you press. When you press this, it makes bubbles, like to bring up the steam. And then you sit on it. Sometimes, if you're so afraid for it to burn, you could put a light handkerchief, a big, the white cloth they used to wrap babies in the hospital,
Yes,
the
Yeah.
swaddle
cloth,
cloth.
yeah.
You just put it over
Okay.
it, and then you
sit on it. Okay.
on it, and then you press this for the steam to come. That's one for the sit bath. Another way of the sit bath, maybe you just want to, for instance, you want to have sex. Your husband has texted you, or your partner has texted you, babe, I'm coming home. We're going to have mad sex. Ladies, let me tell you a secret. Get your sit bath.
Mad sex.
If you have yoni teas, I sell them.
Yeah.
You have yoni teas. Make iced tea out of it. Put hot water, and then you throw ice into it. Let the water come up here, and then you sit on it, and then the ice water. You know what ice does to your muscles? Like when we tell the men to ice their balls, right? It's gonna give this vagina the muscles contract,
Yeah.
right?
Tighter.
It's gonna make it tighter
Tighter.
and very, very lubricating.
Yeah.
Yeah. So, but this is a sit bath, and this is it. It fits directly into your toilet, and you're able to control the steam from here. And if you also want to have orgasms, like Chelsea,
Yes. Yes.
you put the ice water or just normal room temperature water. You fill it up, and then you keep pressing this thing.
I need to try it tonight.
Yes,
I need
darling.
to try it.
You keep pressing it. It's going to, the bubbles are just going to go to your clit.
Oh, God.
And then your vaginal lips is going to go there. And then before you know it,
You have orgasmed in the water.
yes, you're gonna go, you have water orgasms. So this is what it entails. This is a sit bath. And every woman needs this.
Needs
Yeah.
this.
Yes.
So, but this is sold on the market.
Yes, it's all
Regular
in the market.
markets.
Regular
Yes.
market.
You go
if
and say you're looking to buy a seat bath.
Yeah.
come to Sessa.
That's all. That's all.
Right.
So and with regards to I want to just add on to the cold water bit. That's why we always advise that if you want to get orgasm, also use ice while you are giving your partner cunnilingus. You know.
That's
blow
right.
job.
That's
Yeah.
right.
You got
Give
you
the
got
ice.
Chelsea,
Yeah.
Chelsea completed. Add water again with the
Oh,
ice.
good. I can't continue. Continue. I'm not here right now.
Okay, ice and what? Ice and what?
So it's ice. You can also use ice cream.
Of
You know.
course.
No, you're missing something, doctor.
Which one?
Normal ice cubes, and if you have menthol, tum-tum.
Oh yeah,
Put it
yes,
together.
Yes, yes.
Yes.
You know that
It's more even chilling.
burning.
Yes.
Yeah.
Yes.
Yeah?
Yes.
So
I've heard people say that.
some people
and
even
you
use
just give it to him.
just normal Mentos.
Mentos,
Yes,
yes,
gum.
Mentos.
You know that feeling, that cold freshness.
Freshness.
Bit. So when you do that with the ice, with the water, and the vagina contracts, the vaginal wall inside, if you look into the vaginal wall, it looks like a canal with a lot of speed ramps.
Wait, let me put it like this. See, it's like
Yes.
your like this. The vagina
Yes.
is like this,
And
and
it's
then
ragged.
imagine it like rugged,
Ragged.
like your like
Like speed ramps.
going.
Yeah.
That's
You
how
get
it
what I'm
looks
trying to
like.
say?
Okay.
And it is the friction with your penis. That friction that gives you both the sensation and that stimulation. So
Right.
if you do that before, the speed bumps or speed ramps become more prominent and standing
high.
and hard and ready to receive.
With the vagina being tight.
With the vagina being
Being
tight.
tight and lubricated.
You get what
on
I'm trying to
its
say?
own.
So you can imagine that you have just demonstrated, you have just done what
Oh.
Cesar has said in your washroom. Then your husband comes in, darling, I'm in the washroom, I'm coming. Meanwhile, you are getting yourself ready, you're getting yourself
Are
ready.
you kidding me?
You know, this one, when you get there, you don't need to wait for vagina juice.
Nah.
You just need to go in.
Going.
And trust me, you get orgasmic seizures.
Of course.
All right. So,
Did you say orgasmic seizures?
right, I know. Okay, so let's wrap this up.
Yes, please.
Okay, let's conclude on this. Sessa, in conclusion, what would you say?
Please don't keep quiet when you go through vaginal trauma because it can affect you psychologically, emotionally, every which way. It's going to affect your whole life. So please get healing for your vaginal traumas.
Okay.
Okay, so
Chelsea.
okay, I'm gonna say please go to a therapist. If the case becomes so severe, please
See, Cesar.
see a therapist. Please see a therapist so that she can put you through, guide you through on how you can heal very, very fast. That is what I have to say.
Yeah.
Yeah, and the men should come for the prostrate.
And men,
prostate-
please,
prostate.
please, the men, try to come for a lingam massage. It helps to prevent prostate cancer. You can just hit me up and I will perform that kind of therapy on you. I got you, don't worry.
Yeah.
All right,
Yeah,
Dr.
and
Azum.
I mean, I really need to also add that sometimes when you have this trauma and it affects you psychologically, you may have to go and go
Yeah.
to the psychiatric hospital,
Yeah.
you know, because sometimes it's just beyond
Yeah.
that. But what I want to also add is that do not be afraid. Let us understand that sex is an art. That art needs to be learned.
Right.
So let us keep learning. Let us make a daily advancement in our sexual knowledge so that
Hallelujah.
one day we would reach the throne
Yes, so.
in heaven every day when you are going to have sex with your wife. Say that, oh God, I'm coming.
That's it.
All right, now before we go, are there any projects you're working on you would want us to know about? Sasa?
Yes, I'm working on wellness and orgasmic tour,
Okay.
which is coming up in October.
Okay.
It's for couples, partners, and for people who want to up their orgasmic game.
Okay.
Yes. So it's coming up in October. The date will be out soon.
Okay.
And then I will share with you now.
Okay. Chelsea?
Yes, so we're also going on a tour in Nigeria. Nigeria is calling my name, so we're going to be performing a lot of massages over there, and it's going to be next month. So we'll be posting and inform our fans as well, yeah.
Okay. Dr. Azu, anything?
At the Accra Psychiatry Hospital here, so if you need me, just hit me.
Okay, all right. Ladies and gentlemen, thank you so much. I have learned so much today. Two things, ice and the sun.
Yes.
Vitamin D and ice will do
Yes,
the
please.
trick, right?
Yes.
Yeah.
All right. So that's what we're going to be doing. Thank you so much for staying with us. My name is Natalia. Connect with me on social media at Yes, I Am Natalia. And whatever you do, please take care of your private areas. For the men, do not forget to ice your balls. And for the women, ice your vaginas as well, because they will contract and it'll give you all the sensations that you've been looking for. Enjoy the rest of your night. Do try out our sex position of the week if you have a partner. If you don't, I can only wish you the best, because these days the men, so help us God. Good night.